Hello, I'd like to introduce you to Mr. David Lawrence. David is a speaker on our programme Emergency Cardiology. David, perhaps you could start by telling us a little bit about yourself.
Hi Jean, I'm David Lawrence. I'm consultant cardiothoracic surgeon at UCH. I deal with all aspects of surgery in the chest, and I have a specialist interest in valvular heart disease.
Good. Well, why is it so important for an emergency room doctor to understand about emergency cardiac surgery?
The thing is that cardiac surgery can have a huge impact on the outcome of a patient, and an early diagnosis is essential if these patients are to reach us in time so that we can offer the appropriate surgical treatments. This requires two real components. Firstly, the emergency doctor has got to be able to diagnose the condition, and in order to do this, he's got to have a relatively high index of suspicion. Having identified the condition, the patients need to be managed and stabilized and then transferred across to us as soon as possible, but in as good condition as possible. And therefore it's quite important that they know how to both recognize the conditions and also stabilize their patients so that they can be transferred safely.
And the topics that you discuss in your lecture here?
Well, we'll be talking about catastrophic aortic valve failure and the causes of that, particularly the aortic dissection. Generally not a common cause of a sudden collapse, but one that is very treatable, and the outcomes are very dependent on the patients being transferred to us before catastrophic damage occurs.
That sounds fascinating, very exciting, and really at the threshold of the work that we do in the hospitals here. So thank you. I look forward to hearing what you've got to say this afternoon.
It's a pleasure.